initially we don't know much about basically neurological manifestation of COVID. When I start rounding on my patients, basically last February, March, and was surprised by noticing that most of my lists, they're COVID positive versus COVID rule out. At that time, we would not have strong evidence about how COVID is impacting neurology and its neurologic manifestation. Then, little by little, we start seeing papers basically talking about the COVID neurologic manifestation. And again, we found that these neurologic manifestations are frequent and are associated with basically serious cases. Initially we thought also that, many people thought that basically COVID is a great equalizer. It basically affects everybody, men, women equally, rich, poor equally. Then subsequently we found more and more that there is health disparities in basically COVID affecting these patients. We found that basically minorities, especially African American and to a lesser extent Hispanic, they are more affected by COVID, especially COVID neurologic manifestation, than basically other races. As I mentioned, initially, basically, we don't know much. And we thought that COVID is basically pulmonary or systemic, basically, manifestation with basic pulmonary manifestation, cardiac manifestation, eventually by respiratory failure and death. Then subsequently, we noticed that, as I mentioned in the floor, we see a lot of patients with basically COVID neurologic manifestation, stroke, encephalopathy, pain. Then the first paper, there's a couple of papers, they came to emphasize basically the neurologic manifestation of COVID. The first one came from China, when they studied 214 patients with the neurologic manifestations, and basically they reported the association between serious cases or worse prognosis and neurologic manifestation. A second paper came at the same time from Strasbourg, France. And again, they studied basically around 58 patients with in the ICU, admitted to the ICU. And they demonstrated that high incidence of neurologic manifestations of COVID. And again, these ICU patients, so they have basically more serious prognosis. The two papers, again, emphasize the frequency of neurologic manifestation and the association with more advanced cases, more serious cases. I'll be talking about neurologic manifestation and health disparities of COVID infection. So I'll be starting my talk by basically a general review of the neurologic manifestation and basically, a general review about the COVID, the pandemic. Then I will talk about the pathogenesis of COVID infection, basically. And again, I will focus basically on the factor that may emphasize health disparities. Like, for example, there is a gene that may increase the arrhythmia when you have in a setting of a pulmonary infection or pulmonary disease. And this gene is more frequently found in African American, basically, and this may increase the ability or their risk of developing cardiac manifestation in COVID. I will also emphasize on other ACE receptor, which also they are found more in African American, and also they're found also more in diabetic patients. And we know that some minorities, like African American, they have high incidence of diabetes, and this increases their vulnerability to the virus. So we'll be talking about the pathogenesis of the virus and focusing on factors that may increase health disparities. Then we'll be talking about neurologic manifestations of COVID, basically on the paper that they published from China or from Strasbourg, other one from NYU. And then I will talk about the own work here done here at Rutgers, when we basically looked at the Cerner database, which is an electronic database, medical database, and we looked at neurologic manifestation of COVID and basically compare this manifestation to non-COVID patient with neurologic manifestation and to COVID patient without neurologic manifestation. So basically 4 groups will be studying COVID, neurologic manifestation with and without COVID, and non-neurologic manifestation with and without COVID. And we looked at basically also for the same group at the prognosis of myasthenia gravis, the prognosis of taste and smell, which basically we found that the patient who developed loss of taste and smell, they may have better prognosis on COVID patient who developed no loss of taste and smell, which is really interesting. We also looked at the prognosis of encephalopathy in these patients. Then after that, we looked at health disparities and we analyze why we have health disparities, what the cause of health disparity, and focusing on for example, the percent of deaths from COVID in some minority compared to their percentage of the population, their population. We also looked at some other studies, analyzing the death from COVID from UK, and how this basically is illustrated in the health disparities. Then we look at the specificity of health disparities in neurological manifestation. We look at stroke, and basically in academic and non-academic center. We look at also at teleneurology, telestroke, and health disparities. And we look at also the treatment of Parkinson's disease with health disparities. And we look at also at we did a couple of studies from Cerner again, when we looked at the prognosis of patients who are diabetic with and without COVID, with or without neurological complication. We compare these groups basically. I will talk more during my talk, of course. We also compared the prognosis of COVID neurological manifestation, African American compared to Caucasian. We have very interesting results here and surprising results. Then after that, I'll be finishing my talk by talking about vaccination and COVID infection. And probably this is the most interesting part, because I believe that vaccination will bring equality, great equalizer in saving patients and make them resistant to basically the COVID, whether they are black, white, poor, or rich. So vaccination will be a great equalizer. I'll be talking about the benefit of vaccination. I will talk about the studies, the vaccine that we have right now, the benefit of vaccination. And we're also emphasizing also a point. I mean, Dr. Fauci initially basically stated that Guillain-Barré syndrome patients should not avoid vaccination, that he back up after that. I'll be analyzing why basically this confusion about Guillain-Barré syndrome and vaccination. I have a few slides about that. Then I'll be talking also about what the risk of relapse of Guillain-Barré syndrome with or without vaccination. Basically to bring the audience and the public the following message, that vaccination is very important, and so far it's safe. It's really very safe with the vaccine that we have here in the United States, and its benefits, it's much more than the risks. And I will finish my talk about basically answering questions. So, can we get a study that will secure that the vaccine and the vaccination is 100% safe? And power analysis, when you have a incidence of a disease, and you need basically to recruit a certain number of patients in a study to study a rare event. And this number of patients will depend on basically how rare this manifestation. For Guillain-Barré syndrome, for example, if you have to design a study to catch rare event, that's the increase of rare event by 50%, you need to recruit basically 4.5 million. But you need to vaccinate 4.5 million, which means you need to recruit 9 million, which is impossible to get. If we do that, we'll end up having a vaccination every 10, 20 years, and the cost of vaccination will be very high. So we should not basically count on this controlled study to assess for rare side effects. This is basically a bias that I would like to address, and I would like to make sure the public understand that you shouldn't expect from controlled study to look for very rare events. I should rely on passive surveillance about that. I should not stop anybody from getting vaccinated. Also, and I concluded by this, my conclusion will be emphasizing what the solution for this COVID, possible solution to basically for this COVID infection and neurology. And I do emphasize, but among what I'm suggesting, that basically education of the public, and also creating a specialized center for COVID neurology. Well, basically, we offer a comprehensive evaluation of this patient, and management of this patient will be performed. And we have a such center. We created such center here at Rutgers, where basically we have a multidisciplinary center with me, John Back, and also other physicians and other physical therapy, respiratory therapists. We basically take care of patients who had get COVID and get unfortunately to have neurological complications. So we follow them, give them the care needed from multidisciplinary angles, and follow them over a long time.